Hello, my name is Lisa Durr. I am the Director of the Family Birthing Services Unit. I will be providing an orientation to our facility's Healthy Infant Feeding Policy and Procedure. The development of an infant feeding policy and annual orientation to the policy is a requirement for baby-friendly designation. The Healthy Infant Feeding Policy and Procedure can be found on the True North Nursing Guidelines page. To find this page, you would start at the ANMC homepage, go down to the Clinical tab. Within the Clinical tab is a Nursing tab. When you click on the Nursing tab on the left-hand side, you will see a link to True North, and then you will look for the Healthy Infant Feeding Policy and Procedure documents. They are in alphabetical order. You can open both of them from this location. The Healthy Infant Feeding Policy and Procedures can also be found in the Clinical Guidelines pages in both the Pediatric and Obstetric sections. You would go to the ANMC intranet, find the Medical tab. Under the Medical tab, you will go down to Clinical Guidelines. You then select the service that you would like to go to, and they can be found towards the ends of the sections in both Women's Health and Pediatrics. You can open both the policy and procedure from this area. At ANMC, we support and protect a family's infant feeding decision with evidence-based care. To ensure that all information given to families is evidence-based, all messaging regarding infant feeding must be approved through the Healthy Infant Feeding Committee. We do not accept free or reduced-cost breast milk substitutes or feeding equipment or funding from formula manufacturers of any sort. All obstetric, pediatric, and nursing staff who provide care on this unit must attend an ANMC or an ANMC-approved breastfeeding course that is consistent with their position of employment. A woman's feeding decision will be documented in the electronic medical record. She will be provided with prenatal education on how to breastfeed. Immediate skin-to-skin contact will be implemented on all medically stable mothers and newborns unless the mother declines care after proper education and support. Breastfeeding mothers will be assisted and instructed on breastfeeding according to ANMC standards during the postpartum period. An observed breastfeeding session will occur during each nursing shift and documented in the electronic medical record. Rooming in is a standard of care for newborns on this unit. That means that all routine procedures are done at the bedside. If the infant is required to be separated from the mother, this separation will be limited to less than 1 hour of time, except in special circumstances. Breast milk substitutes require a written order. The recommendation for formula should be limited to medical necessity. The details for these recommendations can be found within the Healthy Infant Feeding Procedure, Point 4.8, Acceptable Medical Reasons for the Use of Breast Milk Substitutes. If a mother requests formula for her newborn and had arrived at the facility planning to breastfeed, the nursing staff will be responsible for obtaining informed consent prior to providing the mother with formula. If formula supplementation is necessary or requested, every effort to support breastfeeding should be implemented. This means avoiding the use of artificial nipples, provide feedings with alternate feeding devices, using appropriate feeding volumes, and helping initiate pumping in a timely manner when indicated. Mothers who leave the hospital formula feeding their infants will be instructed on the safe handling, preparation, and feeding of formula prior to discharge. All infants will be recommended to have a follow-up appointment within 24 to 72 hours after discharge. Thank you.